to The Dish. So unfortunately, many of us know someone who might be dealing with cancer, and it's never an easy thing to face, especially when they're near and dear to us, and we're not familiar with the diagnosis. Now, this month's Community Connection Champion is someone who has helped so many people navigate through their journey by educating and assisting in all areas of care and treatment. Joining me right now is Sheila Hall. She is a nurse navigator for the Georgia Cancer Center here in Augusta. Sheila, thank you so much for joining me.
My pleasure.
And first of all, thank you so much for what you do. I know that it's so important to these patients and these families. You are technically the primary contact. Explain to people what being a nurse navigator means.
Okay. Pretty simple, but sometimes complicated. We are the first point of contact for our patients with newly diagnosed cancer. We make the first phone call to them, schedule their appointments, get their records from other facilities, from their referring physician. We also try to alleviate all the what next.
Right.
So we answer a lot of questions about what to expect on the consultation appointment and go from there.
Right.
Just trying to offer a little bit of hope and let them know that they're not in this journey alone,
Right.
that we're going to be there with them to help them get through the complicated healthcare system.
Well, I think it's incredible that the Georgia Cancer Center does that, because it can be complicated. My mom had cancer, and there are a lot of questions, a lot of confusion, and so to have somebody like you that is familiar, that is really can provide some expertise in that area. Now, I know that nurse navigators work specifically with certain types of cancer. What is your expertise? Which cancer?
Well, I have several. I've worked with neurology patients, brain tumors. I've done urology and GYN cancers.
Right. So quite a few, right?
Quite a few, yes.
So tell me about what it means to you personally to be able to help these families and these patients.
Well, I've been in nursing for over 30 years now, and I've had to help navigate family members through the healthcare system. So knowing that this is such a difficult diagnosis that people have to deal with,
Right.
I really enjoy being able to pull all of my nursing experience
Right.
and all the things that I've done, all the resources that I have, and help them find their way through the system.
Well, and one of the neat things about what you do, Sheila, is that it doesn't just stop at your job. You've actually also become a resource for people at your church. And how have you been able to translate that love for helping people from work to where you worship?
Well, I think part of my calling is being a nurse and being able to help people understand the connection between your spirituality and your physical self. So being able to take all the education that I've had in nursing and apply it to answering questions for the congregation is really my passion and what I've always enjoyed doing.
Well, Sheila, you're a blessing to many of these people, not only at your place of work at the Georgia Cancer Center, but at your place of worship, which is really amazing that you're taking your talents and what you've been gifted with and the education that you have to continue that education outside of your workplace. So thank you, Sheila, for everything that you do. And listen, if you need more information or you want to get in contact with Sheila or someone from the Georgia Cancer Center, you can go and visit augustahealth.org/cancer, but don't go anywhere, because when we come back, we're going to end with a message of hope from Sheila. So we'll be right back. Hey everyone, welcome back to The Dish. Joining me right now is Sheila Hall. She's a nurse navigator for the Georgia Cancer Center here in Augusta, and she's this month's Community Connection Champion, and we're so grateful to have you on, Sheila.
Thank you.
Listen, and I'm just so also appreciative of what you do at your place of work, and you also have moved your resources and your help into your place of worship as well, so it doesn't just stop at your job. So we thank you for that. But if you're just joining us right now, I kind of want to give people an idea of what it is that you do. You're called a nurse navigator at the Georgia Cancer Center. Explain to people what that is.
Basically, we're helping you get through the healthcare system, making sure that you get your appointments scheduled, any resources that you may need. We try to provide information about all the services at the Cancer Center. It's not just going in seeing the doctor or just going in getting chemotherapy or going and getting radiation. There's a lot more to the cancer journey, and we just help you navigate through the system to get to those points.
And I know that it's a difficult thing. I mean, when it comes to even just being at the hospital in general, sometimes you have questions, maybe you're embarrassed to ask or you don't feel comfortable asking. I think having a relationship with somebody like yourself can make that process so much easier. Cancer is already a tough thing to have to face, and so having that available to people, I think, is absolutely incredible. So what would your message be to, when it comes to supporting people who have cancer and their families?
Well, I think the biggest thing is to understand that it's the person's journey, and they have to get through it the best way that they can. Understanding that there are sometimes barriers to health care, things that they may need, that you may not be able to help with, or you may be able to. Offering a kind word, taking them to their chemotherapy and just sitting with them and talking to them. Just being there, not trying to tell them what to do, but listening to find out what they actually need.
Right, and they're already having a difficult time, so they need some encouragement through that process. Well, Sheila, we're so thankful that you're there to be that encouragement for patients and their families, so thank you so much.
You're welcome.
All right, guys, thank you so much for tuning in, and don't forget, you are chosen regardless of the circumstances that you're facing right now. We'll see you next time.